tight quads. I'm pretty sure we all do because we all sit all the time. We're a quad dominant society and they can get really, really tight, especially in the hip flexors. I'm Alicia from mobilitymastery.com and I'm going to show you how to release the fascia in your quads and hip flexors today using a foam roller. So if you have tight fascia in your quads from kind of the mid quad up to the hip flexors, you might end up with a pulled hamstring, a pulled hip flexor, piriformis or glute pain, tailbone pain, and groin pain. And I'm going to address all of those today in parts 1 and 2. Part 1, we're going to address the specific technique you're going to want to use to release pulled hamstrings and pulled hip flexors. And then in part 2, we're going to move up to kind of the hip flexor fascia and show you how to release that to address glute pain, piriformis pain, front of the hip pain, and then groin pain. Okay, so part 1 here, we're going to address kind of the middle top of the quad fascia, which is going to help with hamstring pulls, and if you have a pulled hip flexor, this is going to help with that. So basically, I have most of my body weight on the foam roller. My left leg is kind of, the toe is tapping down back there. You could potentially have it off, but that's harder to balance, so my choice for myself and most people is to use a toe tap back there. If that's too much, you can go ahead and bring that leg back onto the foam roller, but I like this because it gets you the best result. And then you're going to roll up and down until you find the seppiest spot. Basically, you're looking for a lump of tight fascia in there, and how you're going to find it is by moving your leg. So you can bend it up a little bit, and then take it side to side. And there was a nice little clump there in my quad. But I know my body, and mine tends to be a little bit higher, so that's probably where I would go. It's going to be different for all of you, but basically what you're going to want to do is you can do these zigzags up and down, or go all the way straight and just roll back and forth. You could do big circles. You could stay straight and squeeze everything in that leg, all of your muscles, and then relax them all. That's a good one. Or you could just do knee flexion and extension, bending at the knee. You want to make sure not to move too quickly, that your movements are kind of fluid and deliberate. And remember, you're hunting out that lump. So if you don't find one, go ahead and move down or up a little bit. And then once you find it, I would stay on there for 2 to 3 minutes, just going back and forth. You don't want to overdo it and bruise anything. And if it's just too painful, bring that left leg in, and then just move the right leg. Okay, before we move on to part 2, I just have a few quick tips for you to get the most out of both techniques, and that is, make sure when you're doing these movements that your feet are flexed, or your foot is flexed on the leg that you're stretching. And the reason for that is you're going to pull that fascial system tight and get the best stretch. If that foot is just kind of floppy and loose, you're going to get kind of a floppy, loose stretch. It's not going to be as effective. And then one other thing is just make sure even though you're flexing that foot and sometimes maybe tensing that quad up and relaxing it, make sure your quad muscle isn't flexed the whole time. If it is, you're basically going to push any of that weight you have on the roller out. It won't get into where that lump is, and you won't get a super awesome result. Okay, we're going to move on to part 2, and that's going up to the hip flexors. So I am going to roll up, kind of, there's going to be maybe a 2 to 3 inch spot up here that's going to be tight, and you're looking for the most painful again, and it's right there on me. So I'm actually that's my hip bone. I'm probably a good 3 inches below the hip bone. And similar thing as last time, you're going to go zigzagging back and forth. You want to make sure that your hips aren't swaying back and forth, that you're really just moving from the leg. And with this one in particular, you may need to actually adjust where your hips are. And it might be different for each of you, but for me, it tends to be right there. So I'm at a slight angle. My right hip is a little lower than my left. I'm on my right leg. And I'm just going to go back and forth. Kind of same thing you were doing before, just a different area. Alright, so that's how you release the fascia in your quads and hip flexors. give this a try and let me know how it goes for you. And of course, if you have questions, feel free to comment or write me.